You're listening to the Confident Choice podcast with me, Dr. Roberto Garcia, a double board certified facial plastic and reconstructive surgeon. Honest conversations and expert advice about the decisions that make you feel your best. Hey everybody, welcome to episode 4 of the Confident Choice. I'm your host, Dr. Roberto Garcia. Today we're broadcasting from a outdoor venue. I think it's pretty nice out. Low 80s, sun. So for all of you listeners in the Northeast, I'm sorry. And we do want to touch on a few things. We had a great podcast last week. A lot of viewers, a lot of response, and some questions where particularly patients are concerned with what is the recovery going to be like from any kind of procedure in our field. And that's probably one of the top 3 questions. And as I wrap up most consultations, I will always try to paint an appropriate picture for what the post-operative course is going to be like. And there is a lot that happens after surgery. And for years, I kind of had this, great, you're going to be fantastic. Don't you worry about a thing. You'll be healed up in a week. And then as I started doing more of these surgeries, I realized, well, that's not possible. That's actually physically impossible. And if you think about the why, any procedure that's meaningfully done and any procedure that's going to have a good long-term result is going to come on the heels of a significant healing period. And let's take, for instance, aging face. The process of the aging face has been a 20-25 year process, and it's physically impossible for me to turn the clock back, say 10 years, 12 years with any aging face procedure and expect for you to be healed within a week. And I think that any surgeon who tells a patient that is being disingenuous. And the fact of the matter is, you are going to have swelling and bruising regardless of the procedure if it's a meaningful procedure. And I mean meaningful in the sense that if it's something that's going to stand the test of time, that's going to last a prolonged period of time. And so patients will go through a very significant emotional course, if you want to call it that, in the first week. And what I've found that generally speaking, surgery occurs. The next day after surgery is day 1, and the body peaks its swelling on the 3rd day. And that is when patients might reflect or complain of some pain. But in reality, it's not so much discomfort as it is tightness and pressure. And again, the human body has about a 72-hour window where you can really curtail the ultimate results. And we do a lot of things in that first week, and we have our patients really actively involved in their care. And I think we talked about last week the active recovery versus passive recovery. And I'm going to kind of go back to that a little bit. And active recovery is what you're going through in that first week, where your body is going through hundreds of changes. And you just shocked it with a particular procedure, and you will have these emotional ups and downs throughout the course of the week that are probably going to make you doubt your decision. That's normal. I expect that. In fact, there may be times that, with my patients, that I'm sure that in that first week they want to kill me. That they think that I damaged them somehow, or that I, made them into a monster or whatever it is, and that's just not the case. the first week, as you're going through those peaks of swelling, and as you're going through the bruising episodes, and as you're going through this tremendous change that occurs in the first week, there's going to be some emotional ups and downs, and patients will get down on themselves and they'll get depressed, and that's a normal thing. I'm almost expecting that. So years ago, probably now 3 years ago, we created something called the Contoura Care app. And I thought it was revolutionary in the sense that what we're doing is we are holding your hand throughout that first week after surgery. And let me be clear, that came on the heels of a major concern that I had. And for the longest time, I would do a surgery, I'd see my patients the next day like I've always done. And then it was kind of like, okay, I'll see you later, see you in a week, pat on the back. And patients go home, and even though they received our book, all of our post-operative instruction manuals, and they have free access to telephone us, and we do the multiple calls throughout the week regimen, it still wasn't enough. And so what I wanted to do was create almost a virtual hand on the shoulder in that first week. And so we created an app that is constantly giving you reminders in that first week. And there's a plethora of videos in it that show you your daily expectations of what you should see. And I found that quelled an enormous amount of anxiety on the part of our patients. And so that made me happy, because now I can control the physical part of the healing, right? I can control the bruising and the swelling. What was hard for me for the longest time was the emotional component of the healing. And so I really feel that we now kind of have our arms around that component, and our patients are much happier within that first week. And so the timeline as to when swelling and bruising goes away is completely, how can I say, it's completely dependent on the patient. And more importantly, it's dependent upon the patient at that time. So I've been in practice long enough that I've had patients coming for their second and third surgeries. And it's not, the classic thinking is, well, as I get older, I'm going to heal poorer. As I get older, I'm not going to heal as well, not going to heal as quickly. And what we have discovered is there's no rhyme or reason to it, ladies and gentlemen. I have patients who are having surgery 10, 15, 20 years later, and they might heal better than they did 10, 15, 20 years ago. And what that tells me is it has nothing to do with your chronological age, but it has everything to do with the state that your body is found in at the time of the surgery. And so now I'm finding patients that are healing faster, that are back to work earlier, probably because of this new movement, this new health movement that we have in America, especially with patients in the cosmetic field who are into self-betterment and self-improvement. And these patients want to heal faster, and so their bodies are in better shape, and hence their results come sooner. And that has been such a pleasure in my practice to find that patients are now so actively involved in their aftercare, and it makes my life as the surgeon so much better. And so the social changes during this healing process are going to be found, right? You are going to have that, when can I get back out with my friends? When can I go back out to dinner with my husband? My thought is this: whenever you feel confident enough. And I kind of release my patients, I say this tongue in cheek, I don't really mean the words, but just understand the spirit in which it's said. I kind of release my patients back out into the wild at around 2 weeks. Now keep in mind, most of my patients are working patients. Most of my patients are still in the workforce, and they are needing to get back to work within a timely manner, and the classic 3, 4, 5 week recovery just isn't doable. And so now I have my patients getting back to work at 10 days. A lot of them, and this might be one of the benefits that happened post-COVID, is a lot of patients are able to work remotely. And so they're able to get back on their computers and do work within the first week. And that has been a game changer for our patients, the ability to get back to work, the ability to become functional again. And again, the emotional impact of you being functional is huge. The idea of having somebody sit in convalescence for a month can have some pretty deleterious psychological effects on somebody. And so we really try to mitigate that, and we try to not let our patients get into that state, and we want them to get back to their normal activities and normal life in a very timely manner. And so that kind of idea of, and I get asked this all the time, what is normal healing? I don't know. And again, you're talking to somebody who's done over 25,000 of these surgeries. And the reason I say I don't know is a simple fact. Every person is different. Every side of the face heals differently. You are going to find that the right side and the left side are going to heal completely dependent from one another. And unfortunately, I can't control that. Now, we do a lot of first week, well, really for the first month, efforts to speed along the resolution of the swelling and the bruising. But ultimately, it all comes down to what physical state you are in. Now, we've talked in past episodes about the emotional state that I really encourage all of you to be in prior to making this sizable leap into cosmetic self-betterment. But I think those are the main things that I wanted to touch upon today in terms of what one can expect from swelling and bruising. Remember that healing is a process, and the idea of patients being uncertain and not really knowing what they're going through or what they're going through, is it normal, is completely expected. And I almost expect that. I know that's going to happen. And like I said, the way that we help our patients get through it is by constant communication. And I think that's been a big part of the success that we've had and that our patients have had, more importantly. So I am going to close with I always say this every week, you guys, my favorite part of the podcast. But today I even have a better part, because I am introducing two basketball gurus, and we're gonna talk March Madness. And I know a lot of you ladies who are listening to this are probably gonna tune out here, so I'm preparing you for what's gonna happen for the next 30 minutes. But we are gonna have some fun and lighten up the podcast a little bit. But an important lesson that I learned early on, my grandfather said it to me, my father said it to me. And that came down to the two most important decisions one has to make in life. And the first one is what career path you choose. And again, a career path might change. So that's not as important as the second decision, and that is who you marry and who you come to build a life together with. And I can tell you for a fact that while I chose my career path when I was as a teenager, I knew what I wanted to be, I didn't know the woman that was going to be in my life. And I can tell you that for a fact, I would not be here. I wouldn't have the practice I've had. I wouldn't have the podcast I'm doing, guys, to be honest, if it weren't for my wife and the support that I've had. And so my grandfather and father really drove that into me, that this decision is critical, because that decision will shape everything of who you are. And one day you won't have your career. One day you might be retired, or one day you might be sick and not able to work, but you will have that second choice. And that is the critical part of happiness. So with that, I leave you for the week. We're going to be coming back and adding in our segment C, I guess, Alyssa, is that what we're going to call it? Stay tuned. Episode 5 is what natural results really mean in facial plastic surgery. Everybody talks about natural results. I'm going to go through my philosophy about natural results, and I hope that you stay tuned, and I hope you are able to see some of our past podcasts. They're really getting a lot of attention, and people are really liking them, only because it's educational. And with that, I'll close off with our tagline: good decisions always come from good information. Have a good week, everybody.